Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We are so excited to have y'all here with us today. Today, this podcast is brought to you by our lovely sponsors, Rejuvime Medical, the age-defying clinic. We have 12 clinics now. 12.
Yeah, soon to be 13, but 12.
Soon to be 13.
Yep.
Yeah, in Louisiana and South Mississippi. And we are doing all things for this age-defying HRT, hormone optimization therapy, GLP-1s, peptides, all the good
Lake
medicine.
Charles is up and running.
Lake Charles
Nice.
is up and running. Lafayette's on the way, and the West Bank is getting started.
Let's go.
So
the West Bank.
we are trying to conquer the world. And of course, Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana with 5 board-certified plastic surgeons, aesthetics, expert injectors, everything you need to feel the
12.
best of you.
Whoop, whoop.
There you go.
I love that. All right, so welcome back.
Welcome back.
Welcome back.
Welcome back. Welcome back. Welcome.
We've got an
back,
interesting
welcome
topic,
back.
which is sort of near and dear to my heart. We kind of bump around a little bit, right? Sometimes we do anti-aging, hormones, wellness, aesthetics, and we're going to talk a little bit about post-operative massage, right? Or lymphatic
Tell me the last
massage.
time y'all have had a massage.
I
want Weiler Plastic Surgery employees to listen to this.
massages.
We gave him a massage probably 3 years ago for Christmas, and he literally just told me, I never did that. Never went and got the
I
massage.
have
That's
told
it.
y'all, stop getting me.
I
hate
just
gift
asked to
cards.
please
Noted.
out him.
Noted.
Noted.
I'm just.
He's the one that you buy him a gift card and it just
Yes.
stays there.
Sits
He
in the
never
wallet.
uses it.
Literally, I have a
That's why
stack.
businesses love gift cards.
Yes, I have a stack of gift cards in my drawer, and I'm talking like
Bring him here. We're going to
Ruth
lay him
Chris-
out on the
Yeah,
table.
roulette.
Right.
Ruth Chris.
Yeah.
like
Great lunch.
restaurants.
Love to hear it.
I feel so bad. I am just
Terrible at it.
terrible at gift cards, and I don't know what it is.
Can you please just take a month and use
I think
the
it's a
freaking gift
male
cards that
thing,
you
though.
have?
But
I think
the
it's a
problem is,
male
like,
thing.
even though if I know I have it, like, I literally had to take them one time and put them like we used to do when the kids were younger. We used to do like a Sunday brunch all the time. So I would have a stack of gift cards in the car, and we would like be like, all right, where do you want to go? You know, we'd like gift card roulette, because I would never use them if I didn't actively have them there, which is bizarre.
But I feel like Josh just has them because he has a thin wallet, so he doesn't put them in
Right.
the wallet.
Right,
And I
right.
think that's the issue is because, you know, me and you, it's
Okay,
what's
I
in our
love a
purse?
gift card. It will burn a hole in my pocket. I am
Uh-huh.
going to use it the day.
Really?
Oh,
That's what
my
I'm saying.
gosh.
I love a gift
Love a
card.
gift card. It's the best.
I don't know. It makes me feel like I'm not even spending money.
Right,
Like,
exactly.
Here you go.
But I do not love a massage. I will not go ever
Why?
and get a massage. I don't know. I think
Why?
it's just
You're
being
like my wife.
still for an hour. I mean,
fall
I think
asleep.
massage therapists are amazing, but I don't reserve that time to like go and lay down and be still and just get a massage.
Is it the time or is it the massage that you dislike?
No, I like the massage. I think it's the time. Like
the
I
time.
could
She
be
won't sit
doing
still for
a
5 seconds.
You
thousand
won't sit
other
still.
things.
I
You love a
freaking
massage?
Love. So we have a special guest today, a masseuse therapist.
It's the greatest.
I don't have the time to do it, but like if I could get a massage, like I would love, and I don't want to be weird. I would love to get a massage, like have someone come to my house,
Yeah.
like because I'm so busy, I get my hair cut at my house, which is
Yeah.
odd, but it's awesome.
That's not odd. I
not
have
odd?
so many friends that have
Yeah.
their
Men,
hairdressers
men,
go to their
men?
house.
Women.
Their
I think it's more of a
husbands.
women thing.
I know,
Really?
but like if their husband, they'll do the husbands and the kids'
Like,
hair
so
too as well.
He comes in and he's awesome. He does all the LSU guys. Named Sal. He's well known in Louisiana, if you know him. Yeah. So, but I would love to get like a massage every week because what I do is very physical.
Yeah.
Yeah.
And so, but like, when we go on vacation, my wife. So the rule is because we're like we do these couples vacations because I love my wife very much.
Finally.
Finally did.
Now that the kids
So,
are older.
and she's like, I can't do it because I got a spray tan. She's gonna rub it off of me, or like everybody has a spray tan, huh? You'd be fine. So, but she doesn't like. I don't think she really likes the massage. She says it's like too firm or too hard.
Yeah.
But like I could not enjoy like.
So do you do one relaxed. Pretty much on every vacation?
Oh yeah, and once we kind of get going on it, she likes it. And we do a few more, but it's always like we have to do it towards more the end, and we stack them up. Kind of like, oh yeah, we do 3 in a row.
We just like the spray tan's gone at this point, so just like let's
spray
do
tan's
it.
gone anyway. Let's go for it.
No, I'm with you. I love a massage. I absolutely love a massage. Josh, like he'll go and get them too, but he's like the rough, like the deep tissue.
I don't like a deep tissue. I like to feel I've got like worked over, and I'm horrible about this. So when I used to get my haircut, now obviously I have this guy comes to my house. I'm kind of like, and I don't know if I can say this. I'm kind of like I used to be a haircutting whore. Like I would purposely
go to different.
I would because I was a plastic surgeon.
Skip around
on purpose for one.
You're my least favorite patient.
Because I wanted to meet all the hairstylists. Because hairstylists are like VIPs in our world.
Oh my
So I would
gosh.
jump around to different hairstylists.
So good.
For number one.
And networking, I'm sure.
Yeah, for networking.
Hello.
Oh, I used to get tons of business.
but also you don't think that hairstylist is like, that's
He never came back.
He never came back.
And so I'm also the guy that like, hey, you want to schedule your next one? I'm like, no, I'm really busy. I'll call you. And I am too, because I used to be really bad with planning before I had my Google Calendar. So
my Google Calendar.
I used to have I'd be operating. And then I'd be literally like, have my nurse be like,
that is very true. I have done
it. It'd be like 5:30. Dr. Weiler needs a haircut at 6:30 tonight.
And they're just like, I despise this guy.
Yep.
And they're like, oh, we have one person available. And they'd be like, okay, well, who is it? Like, it's our level 5 stylist.
I'll take her.
In the day, it's like $450. Like getting a man's haircut for $450. I don't care. I gotta get a haircut. I gotta do something tomorrow. Let's go.
I can't. No.
So I'm the same way with massages. So they have.
Oh, you don't have like.
I don't schedule them, and I'll get like Friday afternoon. I'm like, I want a massage Saturday morning, right? And you're getting the worst therapist on Saturday morning, but a couple times you get lucky. And I had this awesome Helga. I found her around. She was at this. Massage place. I'm not going to mention it. She was from Austria. She was about 65.
And she did a good job.
Oh,
amazing.
Because she just started.
She's amazing.
And I was like, how did I get you? She's like, oh, I just started here.
So good.
Could never get her again because she was booked up for like weeks, right? So no, and maybe it's because I kind of have like an autoimmune thing going on. So like, I'm very physical job. My body hurts all the time.
Yes.
And but like to me, I still do some activity level stuff, I guess, on fence. So I really.
But watching a.
Why didn't we do? You had a fencing tournament.
I did.
And.
So actually, I did a new event that I had never practiced, never done. Bought a brand new sword for it, and I wasn't the worst person there. I beat somebody.
You did?
I beat this guy. It was kind of felt bad because I just showed. I don't even know how to hook things
Taylor,
up.
don't be so shocked when he tells you that he beat someone.
Yeah, but he never did it, never trained for it in his life.
Yeah, I was kind of shocked. Now, and then I got ranked, and I had to actually fight my coach, who whipped my butt, obviously, which is fine. But I actually beat some people.
Do you sword fight at your house too?
Well, me and my son do it.
It's
a little bit too violent.
Well, no, I know that. But are y'all just in the backyard?
Well, first of all, it's hot because you got to wear all this heavy duty canvas stuff. So we did.
Can you get hurt?
Oh yeah, I hurt my hand. Somebody was killed in the 80s.
Don't look at that.
You have to have this mask that they put a spike through because somebody's sword went through the mask in the 80s and killed them.
Oh my gosh.
In the Olympics. So now, obviously, with technology, this was in the 80s, and they were probably smoking at the same time they were.
Right,
that's what I'm like. It was literally like a screen, like on your back porch, like a screen that was that protecting.
So, can you get hurt? Yes. Is it? Yeah, you'll get bruised. You may get cut every once in a while from the sword, but
where does one purchase a new sword?
They're actually you have to get them online. They're kind of hard to. They're kind of hard to find. They really. Like a real one. You get them on Amazon, but a real one is. So I got a new sword, but the handle was kind of messed up. It kind of hurt my hand, but it's fine now. But so actually,
can you not?
I wish
hurt your hands?
you
That'd
could.
be great.
Everybody,
so I need a hand massage.
That's okay. There we go.
I wish everybody could see the life of a plastic surgeon operating all day. You have to be in good shape.
You have to be in good shape.
Truly. And
lipo. I think of lipo.
Yes. It's and a lot of patients are heavy and lifting and manipulating tissue, and it's intense.
A leg alone is, you don't realize, get your partner lay down and totally relax and try to pick up their leg. Like a leg is heavy. I know this is like a gory story,
Yes.
but like when I was a general surgeon, you'd amputate a leg.
Yeah.
And like amputating a leg like above the knee and like carrying it off, you're like, oh, this is a lot of weight.
Yeah.
My
It's
gosh.
heavy. So no, it's a very, very physical job. You're standing all day. I wear compression hose. But yeah, I freaking love massages.
I do too. I support this. Taylor, I think
I know.
if you,
I need to do better.
but like
Truly.
if you just like took a minute,
Yeah.
you'd be like, that was worth it.
Yeah.
Yeah.
That
Yeah.
was
Yeah.
worth it.
And being present, I struggle with that. Right?
Okay.
Like
Unfortunately,
slowing
I
down
typically
and-
fall asleep
I
every
do.
time.
I almost go into a meditative state where
Yeah,
like,
it's
I'm
just-
in and out of it and like I'm
That's good though.
having, I love it.
You need that.
I freaking love
It's
it.
so great, and they have the music and it smell and it's the stuff, and you
So-
just lay in there.
So this topic is near and dear to me because it's like it's not as popular, but like maybe a year or two ago, it was super hot on social media, right? Lymphatic
Yep.
massages, like
all the
everybody was,
stone thing, like
And so my journey with this, so I've always sort of supported post-operative massages, right? But I had a patient around 10 years ago that I did liposuction on. And she came in and she was fairly thin and she looked amazing at 6 weeks. And I was like, well, I got to ask you because like a lot of patients look good, but they don't like this. Like you look amazing. Like, what have you been doing? She's like, oh, I'm a physical therapist. I've been rolling myself and giving myself massages like at my office. I'm like, what? She's like, oh yeah, we use these therapy rollers. And so, you know those big foam rollers where you can kind of start to massage yourself. Like they have those nubs on them.
Yeah.
And those, like then they have like Theraguns. Those weren't around. So
And the Hivamat. You remember that
they
hand
have
thing?
that, yeah. So she she said, yeah, at week 1, I got the roller and I started, and she was like demonstrating this is how they do physical therapy. So she was doing these self massages at home, and then she was like, "Yeah, we do lymphatic massage in the in our office, in our physical therapist office for traumatic injuries and recovery after joints and things like that." And she's like, "Yeah, so I've been doing that," and so it was like, ding, and this was before social media at all.
Yeah.
I think I didn't have a flip phone, but I had like an iPhone 2.
Too.
It took 10 minutes to download a video, It was pretty bad. So, but I was like, wow. And that's when sort of, I think I wasn't like this outlier, but
Right.
I really
You
started.
believed in it.
I believed in
Yeah.
it. And I really started implementing the rollers in my post-operative.
Okay.
Now we don't give them the patients, but we show them the patients. And
We
say-
have them in clinic
Yeah, we
to
have them
show
in
them.
clinic,
Yeah.
and we tell patients. Most patients can tolerate it at around 7 to 10 days.
Okay.
A post-operative.
And you
That's
know
what I
we're
was
talking
about to
about
say.
just like that big.
Should have
like
brought
the
it today.
foam roller.
Yeah, foam roller.
Yeah.
Tracy's gonna put one up on the screen for you guys. But,
Yes, yeah.
It's just they can be studded, they can be flat, they can vibrate. You can don't get the little tiny ones, the little facial ones.
No.
but
You
get a
need,
bigger
like, the
one.
big one.
I love the big ones, and you can lay on it. You can
Yep.
put it against the wall. You can have your partner roll you out. But I always tell patients is think of yourself like a big piece of dough, and roll things into the lymphatic basins. Okay, and so
Okay, back it up.
Yeah.
Right, okay.
Lymphatic base.
all right, so.
What is the lymphatic system?
All right, so I'm going to explain this because this is going to be a great intro to our masseuse. So lymphatic system, all right. So think of your body as plumbing, your heart. Your heart is the pump, okay? It pumps the fluid blood out through your arteries. It goes to the very, very tips of your toes, okay? And then it comes back in through your veins, okay? Now, during that process, those pipes are not leak proof, okay? And so what happens is they leak a little bit, all right? And you get a little bit of swelling. You get some lymphatic fluid that accumulates, okay? And so that lymphatic fluid, once it goes out and is leaked out into your body, it doesn't go back into the veins because both of your arteries and veins are under pressure. Arteries are high pressure, veins are low pressure, but it's still pressure. So it seeps almost like drainage into your lymphatic system. And your lymphatic system is the slow drainage back into your lymph node basins. And lymph node basins are they're basically filters and collectors of lymphatic fluid. So you have them in multiple areas of your body, but mostly they're in your groin area, they're in your armpit areas, and they're in your neck areas, okay? And so when you do surgery on anybody, if it's liposuction or any type of incision, so if it's liposuction, you're disrupting those lymphatic channels. With surgery, anytime you make an incision, you're cutting across those lymphatic channels. So you get congestion or buildup because those channels aren't functioning very well. And so you get swelling. lymphatic congestion equals swelling. And so you have to help that swelling go away.
You have to manually assist
it.
that drainage process,
Right.
basically.
Yeah, and so when you roll, simply, we'll get into lymphatic massage, which is awesome. You are manually pushing that fluid through those disrupted channels and forcing those channels to sort of even reconnect. And so what happens with lymphatic fluid is it goes into the lymph node basins, then it enters larger pipes, which then goes into your chest, and you have a big lymphatic vessel in your chest, which then dumps back into your artery, and then it goes into your kidney and it gets excreted as waste through your kidneys and your livers. So lymphatic congestion is
It really
real.
is so cool, and you did
so
such
cool.
a great job explaining
Did I?
that.
Okay, good.
It's, yeah,
Like,
it's exactly.
The lymphatic system is fantastic.
Yeah, it's
Truly.
a very mysterious system.
Yes.
Plastic surgeons specialize in a lot of lymphatic stuff, lymphatic lymph node transfers and things like that. So, but lymphatics can be affected with illness, with just general surgery, especially with liposuction, and especially anything you make like an incision in, like a tummy tuck, breast lifts, breast reductions, facelifts, all that stuff. And there are situations where people have naturally born with really poor lymphatic systems, okay? And you can get large swollen limbs because you have poor lymphatic systems. And then cancer surgeries can cause lymphatic congestions from radiation or surgery.
Yep.
Or removing the lymph
and
nodes.
removing the lymph nodes to treat cancer. And that's where lymphatic massages sort of really kind of were developed. So in my practice, we recommend manual rolling or self sort of lymphatic massaging, which is simple to do, easy to start, and can make a significant difference. And so we tell patients to buy a roller. Most patients physically can tolerate touching those areas around a week. Like you'll see online these crazy people on TikTok that have surgery and then like the next day they're getting then you're not having a real surgery.
And we're talking incisions here, so we want that to
so
heal
you want to be
properly.
careful. You don't want anything touching your incision for a couple of days. So, but no, it's become a very large part of my practice in terms of recommending the rollers and then also recommending lymphatic massages. So,
So going back to a tummy tuck or liposuction, specifically those two things. Explain, obviously it's surgery, but we also are placing fluid on that area too.
Yeah.
So explain the
with
tumescent.
Oh yeah. So with surgery also, so we numb those areas or protect those areas. If it's a simple surgery, we may inject some local medication. If it's like a liposuction or a tummy tuck surgery, we're actually putting what's called tumescent fluid. It's a fluid that's got a combination of lidocaine, which is a numbing agent, epinephrine, which prevents bleeding, and it sort of protects the skin. And so we put a large amount of fluid.
And saline.
Yeah, and saline, right? And so I tell patients it's not unusual in a large procedure to put 5 or 6 liters, sometimes even more of that below the skin. And not all of that is removed when we do the procedure. So some of that's stuck beneath the skin and your body has to excrete it.
Hence the lymphatic system.
Lymphatic massage. And so anytime we do like a liposuction or a tummy tuck or really even any surgery, we put patients in compression. And so compression is like if you're doing a tummy tuck, we put you in like I call it a girdle. Some ladies call it a faja. You can call it all kind of stuff. But basically what it is, it's a garment that pushes and holds the body together, and hopefully it pushes that fluid out and prevents accumulation of fluid. And so like facelifts, we put them in, we wrap their faces.
face.
Yep.
Face
We
bra.
do- right? If
Face bra.
we do arm liposuction, we put you in arm wraps. We do implants, we put you in a bra to help hold, right?
All to prevent fluid accumulation
Correct.
and to
Correct.
compress the area.
Push it out.
She wanted to know what a faja was. I saw her face. What's it stand for? What's a faja stand for?
So a faja is it's a religious name for, it's a very complicated evolution. So a lot of people these days, I know it's sort of weird. So it's a compression garment, and faja, the origin is a religious garment of compression, right?
Really?
Yeah, it's
Okay,
It's a
that's not
religious
what I
name,
thought.
faja.
I don't
Okay.
have a phone. I would
It's
look it
become
up.
part of the vernacular, right? Yeah.
Yeah.
So it's in prayer
Pregnancy,
for
work, and
postpartum.
prayer.
Yeah, and so it's become sort of accepted lingo to call it a faja. I don't know how that started. It's
Once
not a
again, the
name
more you
I
know.
like. I don't want to offend anybody, so I don't say the word faja.
Compression garment.
But a lot of people call it faja. So it's a compression garment. It's like a Skims garment.
Yes.
Yeah.
Right? It's like a
Spanx.
Spanx
Yeah.
now. Yeah.
We
Kim
saw the
Kardashian's taken
Skims
over.
head garment.
Oh, really? I haven't seen that.
You haven't seen it?
No, it holds up.
Yeah.
Oh, wait, I think I have seen that.
They made a huge
Yeah.
joke out
Okay,
of it.
yeah.
Like it was a very they were
holding
like
up the gravity
Yeah,
of
it
the
was
face.
supposed to be. It was supposed to like, oh, I cannot have a double chin if I wear the skin garment.
The skin
It's
garment at
like,
night?
no, that's not. But Skims came out with a head one.
Hey, people will try anything.
They will.
I'm here
Oh.
for it.
I know. I'm here for it.
I mean,
well,
they
look, some of it
probably
is also
sold-
women, menopause. I mean, women that cycle you retain fluid. So
Yeah.
you can squeeze that fluid out.
Yeah.
Yeah.
Right?
Yeah.
And then, it's an interesting concept. So yeah.
Yeah, you don't have to have surgery to have a lymphatic
No.
massage. Yeah, like
it can be. Some people have poor lymphatic systems. Some people just naturally hold fluid. So it can be beneficial for all.
yeah. Which leads us into
Our special guest.
our special guest who does lymphatic massages, which is fantastic.
Yep.
Fantastic for the healing process and fantastic for just in general. And she's going to tell us why. So before we bring her on, we're going to take a quick break and we'll be back in just 1 second.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Welcome back. We have our lymphatic massage pro expert with us. This is Caitlin. Caitlin, thank you so much for joining us today.
Good morning, everybody. Thank y'all for having me.
All right. So, Caitlin, tell us a little bit about yourself.
Okay, so I've been a therapist for quite some time, almost 18 years now.
Oh my goodness.
I graduated and it's really all I've ever done.
Oh, okay.
Yeah, so I graduated in 2007 from Blue Cliff College. That school is now long gone. But I graduated from Blue Cliff College. I did a lot of sports recovery for a long time, and then my body kind of started giving out. And that's when I kind of switched into lymphatic drainage, when I kind of became a little obsessed with it.
Okay.
So I got my certifications in manual lymphatic drainage, and then I saw a huge need in our community specifically for post-surgical.
Yep.
I didn't find that there were many people around us that were certified in that post-surgical aspect. So I saw the need and just kind of went for it. And then it ended up being, I got several certifications. I'm continuing my education constantly just to make sure we're most educated on promoting that health post-surgery. And I've been doing this now specifically and only MLD therapy for since 2021. I've kind of stopped doing everything else and just focusing on the MLD aspect of the body.
Wow.
Which should, that tells you like how important that is.
What does
Like,
MLD mean?
Yeah, educate our
MLD,
audience.
thanks for asking. Yeah, MLD is manual lymphatic drainage, and it's just basically a very fancy way of saying that we are moving the body's lymphatic fluid into those lymph nodes so that the body can stay clean, healthy, and running optimally.
Love it.
Can you tell us or educate our audience on what the difference is? Because we were bantering before we brought you on how much I love a massage and how Taylor has problems being present and staying still in a massage. What
Taylor,
is
maybe because this is like
Yeah, healthy.
This is a medical
This is
purpose that you will stop and
Yeah.
be like, you know what, I shouldn't enjoy this. It's a
You're
medical
right.
person. And then you'll start enjoying it, and then you'll be good to go.
Tell us what
Yeah.
tell us what the like the difference, and obviously you're not doing the traditional, what a
Traditional
massage traditional
massages.
is and the purpose, and then what the difference is with an MLD massage.
Yeah, absolutely. So generally people think of a massage as like they want to come in and have some sort of muscular work, right? That's what most people do it for now. So what I'm doing is I generally don't get into that muscular work. We are working just under the surface. It's a very light, rhythmic, gentle, incredibly relaxing service. So what we're trying to do is just clear the body of any toxins and waste that is sitting and stagnant. We're trying to move that out of the body. So it's really, really light. It's very rhythmic. It's super relaxing. But people generally think that when they come in, the thing that people ask the most is it going to hurt?
Right.
No.
Yeah.
If it hurts, they're doing it wrong for sure.
Okay. So in my experience in a massage, and you're actually probably educating me because I've never had a lymphatic massage. So
I think we should go do
my
it.
only
You
experience.
guys should all come try.
No, I need to. And you made an interesting point because I was talking earlier, like when me and my wife go on vacation, I love massages, and she's sort of the reluctant massage receiver. So we went somewhere and she got a lymphatic massage and I got a traditional massage, right? So usually I'm like, oh, that was great. Got in those muscles. And my wife came out and said, God, that was like really light. They were like just barely touching me a little bit, right?
Yeah.
And so I'm used to like feeling or, getting worked over. So when you say rhythmic and light, can you explain that a little bit more? Like what a patient should experience? Because I think a lot of, obviously you're certified, this is your focus. I feel like there's a lot of like maybe part-time lymphatic people like, oh, I'm going to give you a lymphatic massage. That's not really. So can you be a little more detailed about what you expect? Because like,
That is a good point.
verbalize
Yeah.
it a little bit better.
And so I don't know, not everybody knows this, but the name of my company is MLD Therapy, Progressive Lymphatic Therapy. So I think what sets me out from the traditional people who throw in there that they do lymphatic massage.
Dabble in it, if you will.
Yeah, so what I'm doing is I am approaching your body in the stage of life you are in. So, I mean, whether it be post-surgical or not, we really need to assess where your body is at the time. And there are times where I will put more pressure or do some contouring or, address other issues. But generally speaking, a classic lymphatic drainage is going to be incredibly light. We're going to use pumping techniques where we're going to basically milk those lymph nodes, and we're just sort of moving everything very gently because the lymphatic pathways are right under the skin. So if we go deep, we're just dispersing all of that fluid and we're not actually getting to it. So in order to clean that lymphatic system, we have to go light and gentle. But there are absolutely times where I am going to need to go in and contour or go a little deeper or release that fascia so that that lymphatic flow is not suppressed. But
That's
so
really interesting.
that's really what makes us stand out from everybody else is that we are progressing with the healing. We're not only doing that very gentle rhythmic massage, we are moving with the body.
Do you find this helpful for any, is there a surgery, a post-op patient that you're seeing that this is like very good for versus some that it's like, I think it's good for everything, but is there like specific surgeries that?
Absolutely. So generally speaking, if you're alive, you can use a lymphatic massage, right?
I like that.
It
I
just,
like that.
anybody can benefit.
Right.
But honestly, the biggest procedure that I see that benefits the most is obviously going to be a liposuction because that cannula does more damage than just a single incision. So I highly recommend any liposuction, even if it's minimal, just the flank area. Getting that manual lymphatic drainage and getting it early is going to be the key to a great recovery.
And how long after surgeries are you seeing patients coming in for the lymphatic massages?
So generally speaking, we recommend start 3 to 5 days post. which is
Okay.
very soon. But the sooner we get this debris and these dead blood cells and all this bacteria out of the body, and in some instances into these drains, the quicker your body can recover. The longer that lymphatic fluid sits in those lymph vessels, the more likely it is to become hard and stagnant, and then it becomes fibrotic tissue, and then we're looking at hematomas and bacteria and infections. So the quicker we can get it out, the faster you're going to recover.
I didn't even think about that when you said drains,
Yeah.
because you know you have
Yeah, so we
you
like
have
to
drains.
utilize. Yeah, we like to utilize the drains. So generally speaking, I know where the drain placement is. So I'm going to utilize those drains as well as the lymph nodes to just speed everything up and get it out.
And now that you said, because it's so, you know, like we were saying, after you have the surgery and, you know, the incisions and stuff, but I guess initially I'm thinking that they're going to like get into it, but she's saying, you know,
light.
like with it just being so light, then, you know,
Do
after
you,
you get.
Caitlin, do you like to see these patients before the surgery to establish this, or talk to me about that? Because you mentioned a little bit about that also too. Yeah.
Yeah, so in order for you to have optimal healing, obviously the slate should be clean before we go in. Now I know it's not always an option for everybody, but in a perfect world, I would see a client every week for 4 weeks leading up to the surgery, just to get your lymphatic system completely clean and ready to heal. And that would just sort of speed everything up on the back end if we go in with a clean slate.
Okay, I have all the questions. Sorry.
Go ahead.
Do you have something?
I was going to ask her. You go ahead. What are you going to ask?
No, go.
No, I was going to ask, what do you recommend post-op series
okay.
wise?
All right, yeah.
Is that what you're going to say?
No, go ahead.
Okay, so post-op, I usually recommend doing 3 services in a 7-day span. So it's generally like a Monday, Wednesday, Friday. We do that 2 weeks in a row, and then we try to start spacing out sessions. But if you wait too long between your initial session and your follow-up, we create stagnancy back in those lymph vessels, and everything gets hardened, and we're kind of starting over. So it's important to kind of do those quickly in the beginning, and that's going to increase your lymphatic flow and excretion of all this waste, and it's really going to jumpstart your healing process and decrease that swelling and inflammation. So we like to do 6 in the first 2 weeks, and then after that we like to space them out to 1 or 2 a week, depending on where you are in healing. But we really like to have you kind of out in your body's optimal function within that 4-week mark. You know, because we know it's not possible for you to come in every day. So we try to give you as much education personally, so where you can do those things in your home and do them effectively, because we do find that people come in and they'll say, you know, my surgeon told me to self-massage, but I don't know what that means. So I go in and kind of educate them with the understanding that the more you do on your own correctly, the quicker we're all going to get through this. So I try to get them in and out as quickly as possible.
I like that too, like educating that home therapy as well, because I always bring it back to, you know, Taylor, like protecting the investment. And so it's like, yeah, you have the injectables, but you have to do the skincare.
Yeah.
It's like, yes, you can get the lymphatic massage, but there are some things that you need to do yourself at home. And I think that education is so vital for these, for these post-op patients that are, you know, in that recovery phase.
How long does the massage take? Like 3 times a week for 2 weeks.
Yeah.
So 6 visits. How long per visit usually?
Generally, it's a 45-minute. I have found that anything less, I'm kind of scrambling to get things done. And then anything more, the client sort of becomes uncomfortable. 45 is kind of like my sweet spot. Now, if I have to go over, we can, absolutely. But 45 minutes is usually the sweet spot where we can get everything flowing. We can generally get them back into their garment much easier. We just see improved mobility and tissue health at that 45-minute mark.
Well, it's like you got lymphatic sludge.
Yep.
That's literally what it is.
So it's like you've got like this sludge that you're trying to get to be like that thinner, more like moving that sludge out of there.
Are you focusing just on the surgical areas,
So
or are you
that is a
doing
great
full body?
question, Dr. Weiler. In the first few sessions, we focus more on that surgical area, but generally speaking, we like to do the entire body. Now, we are going to open the nodes in both the armpit and the groin area, but we do spend our majority of our time focused on that surgical area to make sure that is moving correctly, and then we'll just eventually we'll do full body.
Nice. What do you do? So are you urinating more the day of?
Also,
Yeah.
also a great question. So the lymph vessels is what collects this debris. What I go in and do is pump out those lymph vessels to the nodes. The nodes do the filtration. Anything the body needs, it's going to dump back into our bloodstream, and anything it doesn't need, it's going to go to the liver and the kidneys, and that's going to come out via obviously urine and stool. So that's how it excretes the body.
The body's
So you need to be
wild.
crazy hydrated.
And look, Taylor, that is so important. Like, people come in here and I always ask, what's your fluid intake? And, oh, well, I drink 2 bottles of water a day. And I'm like, you have to understand your lymphatic fluid is 96% water, like 96%. That's a lot. And whenever you decrease that hydration, I mean, that
Then you get the
it becomes
sludge.
Sludge.
Yeah,
You get the sludge.
It's real. That's a thing. Yeah, the sludge builds up, and then it's so much harder to move that fluid. And that's when we start to develop fibrotic tissue, hematomas, seromas, because that debris cannot exit the body.
I love this. Everyone should have lymphatic massages after surgery.
If you're alive, you need
Yeah.
one.
If you're alive, you need one. I love this.
Caitlin, let me get your approach, your opinion on post-operative compression suits. Does that make sense?
Yeah,
Do you have an opinion on that? I
absolutely.
would love to hear your take, because
I
you're
absolutely do.
Yeah, what you thinking?
So I have seen the gambit. You know, I have seen the clients come from out of state that think that the compression is not working if you can breathe. And then I have seen the clients who come in and say, oh, it's too tight, I need it looser. So I am a firm believer in a properly fitting garment. It should not be too tight. Obviously, too tight is going to trap and restrict. Anything too loose is going to allow for expansion in tissues and cause more swelling. So a properly fitted garment is so important, at least for the first 8 weeks.
This is your
100%.
Cinderella. This is your glass slipper for the first 8 weeks.
Absolutely.
Just perfect.
Just right.
Yeah, and it's hard, you know. And I do have patients come in here all the time just for garment checks, because they generally see me in between seeing their surgeon, right? So sometimes a client will lose way more fluid and swelling, and there's a point where we need to add a lipofoam or a compression or something else. And that just really helps speed everything up if they are going to see me between visits with their surgeon, so that we can kind of make the best recommendation so that they don't become stagnant.
Yeah.
Because that does happen. Absolutely. People will get stuck in between those visits.
Talk to me. You mentioned lipofoam, which I love in certain areas. Talk to me your opinion on those boards.
What's a lipofoam?
So
A board.
Yeah,
A board.
Go ahead, Dr. Weiler.
No, so I was gonna. So lipofoam is not all bodies are built the same, right? And so lipofoam you can place inside of the garment on the skin to create a better contour and a better compression area.
Okay.
It's like a thick white piece of like marshmallowy foam that helps contour the area, but gives it like light pressure without deformities.
And you know, unfortunately, Caitlin was saying, like, garments it's important that they're well fitting. We can't carry, we're not Dillards, so am I, or we're not Skims, right? So we don't have every model, make, and whatever. So some people like it fits perfectly, and other people like with short or long torsos, or some patients are more bottom heavy, or depending on the surgeries that we're doing. So you can add lipofoam to get
give that better fit.
I wanted to get her take. They're not as popular as they used to be, because about a year or two ago, like, boards were like super popular. I'm not a big fan. So tell me your take on boards.
Well, I'm so happy to hear you say that, because I very much dislike a board. But I want to kind of tell you some of the differences between the lipofoam and the board. So the lipofoam from a lymphatic drainage standpoint, that foam has a very specific texture and feel. And if you touch it, you'll notice it almost feels sticky. So we want that lipofoam to be on that skin. We don't want anything between that skin and that lipofoam, so that every time you move, that's actually massaging those lymphatic pathways, because it's going to stick to the skin. So it's doing sort of two jobs there. It's adding that extra compression, but also it's giving you that lymphatic massage every time you're moving. It's putting that pressure on that skin, and it's moving that debris out, which is really, really good for keeping everything soft between visits.
Okay.
And then you have that board. That board is hard.
That board.
It's hard. It generally traps fluid because there's no stickiness to it. It's not moving anything. It's just trapping everything right where it is. You can't bend over. You can't use the bathroom. It's just causing way more damage than it is any sort of good, especially in the early stages. Now, there are some people who surgeons from out of state recommend doing the board immediately, and I have personally witnessed so much fibrosis from these boards. I mean,
it rubs the skin right at that base. I've seen a wound from the board.
Yeah, it's opening incision.
You better not have a board anywhere. Huh? So you better not have a board.
Yeah, no.
I'm not.
Caitlin's coming for you.
I'm a huge anti-boarder too. I agree with you. I mean, further down the line, if a patient wants to put a board on because they read about it on TikTok, I'm okay with that. But I'm an anti-boarder for at least.
But I think it's kind of going away. I feel like 2 years ago it was a little craze.
Oh, it was the thing.
Yeah, it was. It's crazy. And there's so much information on social media that it's hard to combat the bad stuff, right? And I'm sure you combat it all the time. So it really is kind of crazy.
So the number one question I get asked, speaking of combating online fictitious, is that am I going to reopen a wound and force fluid out? That is the most common question I get.
Really?
So that's illegal. That is not lymphatic drainage. I am never under
so they were asking you if
you're intentional.
You're going to intentionally open that wound and push the fluid out.
Yes.
Really?
They want.
Really?
Yes. So
is that more for a seroma management?
No, just
in general.
Just in general.
Wow.
I think people have a hard concept of understanding what lymphatic congestion is and what
absolutely
and
so you use the word drainage, right?
Right.
And they immediately think that we're literally going to drain something from the body, and they very often ask, are you going to open my incisions and push fluid out? And I will never do that. That is,
if somebody does that, that's very unsafe.
Yeah, they do.
Don't let anyone do that. That's insane.
Yeah.
It's illegal, and it's not something I would ever do.
Oh my!
I didn't know about that.
What other crazy questions do you get, or what other myths?
Yeah, so that's the biggest one that I just would like to clear up, that's not what we're doing here. And then people always assume that if it's not hurting, it's not working.
Right.
But again, Dr. Weiler, I think you hit the nail on the head. They just don't understand what lymphatic drainage is.
Right.
They don't understand what it's doing, how it's functioning. And so when they get here, I try to educate them on that and what we're doing, how we're cleaning it, and where it's going. And I think once they leave, they feel much more confident in doing that self-care. But those are the two biggest questions. Is it going to hurt, and are you going to reopen me?
Wow.
Yeah.
Oh, wow.
Yeah.
Do you see most of your patients on Lasix after surgery?
It varies. I have a love-hate for a LASIK, because dehydration will cause that sludge to build up, right?
You're taking away the fluid.
Yep.
Yeah, because you're taking that water out of the system. So from my experience, I found that the client generally does not rehydrate properly. I mean, it just is what it is. So whenever you introduce that prolonged LASIK use or any sort of diuretic, they generally increase in swelling, and we just see different problems because they're not hydrating. Now, if they stayed hydrated, it would be a different story, but they usually they aren't.
Right. Yeah.
No, I agree with you.
Interesting.
The
I like
problem is people think they're swollen, so they're going to drink less, right? And then you
Yeah.
so you really have to tell
You
them
should increase
you got to
it.
increase your,
Right.
your consumption
Right.
of fluids.
And so the education is so important.
Yeah.
I'm just
And
really
that's
trying
why we
to,
do this.
tell. Yes.
Talk to us about other people, other major groups besides like post surgery that can benefit from
Lymphatic
drainage that you see in your practice.
I see a lot of wellness clients who I see once a month just to keep that lymphatic system going. Obviously, it works in conjunction with your immune system. So I do see people who try to come into like during allergy season. We're just trying to keep everything moving. Yeah, so I do a lot of sinus drainage massage, and
You stop right now.
I
I have
know.
the worst sinuses in the world. I want to come see you.
I typically get an influx in patients when that spring comes around and then that fall season, just because people are trying to stay on top of it. So we're decreasing all that junk sitting in the sinus cavities. Yeah, it's pretty incredible. And then just my general wellness clients that they usually see some sort of naturopathic doctor or natural medicine. And so they do see their lymphatic therapist in conjunction with their naturopathic doctor.
We are scheduling an appointment with Dr. Weiler to come and see you. He needs a lymphatic massage.
But
We all
wait,
do.
I feel like this is like you're such a healthy
Yeah.
individual.
Yeah, I wanna come and
Like,
get one.
This
It's
is
awesome.
I, on the other hand, this is like the TMI. Like I've got retention cysts like in my sinuses, and I'm like, well, now I need
Yeah.
to.
Yeah.
Now
What about
we can all
breast?
go?
What about breast cancer patients?
Yeah, so I am actually taking a course right now on breast cancer and lymphatic drainage. But we do generally see a lot of double mastectomies. So the scarring under the arm is generally pretty gnarly. It gets really stuck in there. So I also have a couple of little tools that I use, some microcurrent devices and some heat and vibration that will kind of stop that fibrotic tissue and that scarring and that roping. So breast cancer patients are a must. Also, we have that roping that,
The scar
under the
tissue
arm.
you're talking
Yeah.
about? Yeah.
Yeah. So we see a lot of breast cancer patients for sure.
Wow.
And just for our small, do you see any patients that have like congenital lymphedema issues at all? Is that a part of your practice or not really?
So I try to refer that out to somebody with a lymphedema certification.
Right.
While we have training in lymphedema, that's just really not my focus.
Yep.
So I try to send that to that professional. Now there are some people who just want to come in and see the difference between what I'm doing and what the other people are doing. But generally speaking, I try to stick to what I know, what's in my wheelhouse.
I love that.
Yeah.
I would, like we were talking, I don't know, the last episode when you were talking about going to the hair person that like does this all the time, all the time. Like
the hair transplant.
Yeah, like
Yeah.
that's their
yeah.
thing. That's what they do. So like your thing, that's the lymphatic drainage. That's what it is. And like knowing that is your realm and not trying to dabble
Yeah,
into
I don't
all the
want an
others.
umbrella at all.
Yeah.
I want to stick to what I know. I want to perfect my craft, just like you do,
Love
Dr.
it.
Weiler.
I love that.
You know what you know, and that's what you do.
Absolutely.
That's so good.
Yeah.
I want to cut. We're
So
all
good,
coming.
Caitlin.
I'm so excited.
I know. One final question. So patients that are, is lymphatic massage, can you like, I know some people that get like a regularly weekly traditional massage, right? Is this like an adjunct that you would say, or is this a replacement sort of lymphatic LMD massages? Does that make sense? Sort of like,
Yeah, and that's actually a great question too.
Right.
I offer a combination massage.
oh, really? Okay.
Oh,
really?
Dr.
Yeah.
Weiler.
So I will say a lot of people don't want that simple, gentle, rhythmic massage. A lot of people do still believe I want to feel it when I leave.
Sure.
So I do offer that combination where we are doing the lymphatic massage, but I'm also incorporating muscular work and fascial release and getting all those knots to move. So that is an incredible question. It could absolutely replace your regular massage.
Okay. Good.
And
There you go.
with the added benefit of manual lymphatic drainage.
Yeah.
I know. Like
That's
that's it.
amazing.
I mean, just taking it to the next level.
Yeah, it's actually incredible. I'm very passionate about it.
I love that.
Anything you would want to leave some words of wisdom as we sort of close it out here? Anything that you
and
know?
patients, just like, obviously you're informing them, but
Right.
what would you tell the audience of like they're thinking about it, dabbling in it?
Dabbling.
Like, yeah.
Because I think you're such a
Yeah.
great resource. It's not.
Yeah.
It's hard for patients to find someone like yourself.
Yeah.
That truly is passionate about what they're doing, and it's
Yep.
not just oh yeah, I do that on the side, kind of deal. And so I think it's very important that education is important.
I do too, and I think a lot of the clients come to me, like I said, between when they see their surgeon. So a lot of times I'm just a moral support. They come to me and say, "Is this normal?
Right.
Should I look this way? Should I feel this way?" So a lot of times I'm just a cheerleader in their corner, really helping them feel better. So my advice would always be to try it, even if you just do one. If that's all you can do, one is better than none. And moving that sluggish lymphatic fluid has got to happen. So at least do one. Give us a shot. If you
Right.
hate it, you don't ever have to come back.
Right.
But at least we get it moving, and that is the most important thing.
I love it.
So good.
I know. This is so interesting. Caitlin, thank you so much for joining us today, sharing all of your knowledge regarding this. This is so great. If you are in the South Louisiana area,
Yeah.
go see Caitlin.
Yeah.
All three of us are. We're going to make
Thank you guys. I
Caitlin,
appreciate
Unfortunately,
the
there's only one of
time.
us, so we can't get.
I was about to say, we're going to tie Taylor down and take her to get a lymphatic because it'll make you healthier.
That's right.
Taylor, I'll give you so much education that you won't need your brain to shut off. We'll
Love it.
Yeah.
talk
There
you
you
through
Love it. Love it. Let's do it, girl.
It's just not
Yeah.
it just can't be a relaxing thing for Taylor. She's got to it's going to be an
gotta be a lunch and
educational
learn. It's
It's
gotta be a
gonna be
massage and
a lunch and learn. Well, thank you.
Thank you guys so much for having me. It was such a pleasure.
Thank you
you're
so
welcome,
much, Caitlin. Thank you so much for your knowledge and everything. Everybody else, remember, don't forget to subscribe, like.
Hit the button below.
We're on all of your podcast platforms, Spotify, Apple,
Amazon
YouTube, Amazon, all the things. Make sure to follow us. This is so great, so educational.
So good.
And it's kind of funny sometimes. But also just remember, always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.